Okay, so people have been stopping me, asking me about the research, and I did get that guy's name and number, so no worries, anybody. So the next item on the agenda is our clinical research team at UC, GNI. So I'd like to invite Aaron Blomer, Kevin Duke, Angela Shake, Bobby Stubberman, and Lauren Wingler. These are all our research coordinator, research experts. There's stairs on the other side if you want to. And let me tell you, research coordinating is a big job. They have lots of I's and T's to cross. They take great care of patients, which is the fun part of it. But they're going to talk about all of the studies and what's available at UC.
Thanks, Maureen, for this opportunity.
Here's the press for the slides. Just the green.
Okay. So I'm one of the research coordinators at UC. My name is Aaron Blomer, and I work on behalf of Dr. Espe. So the first study I want to talk about is the CCBP research study. As Dr. Espe alluded, it's a precision medicine approach for the diseases of brain aging. We want to reclassify Parkinson's disease, forms of atypical Parkinsonisms, as well as other forms of dementias into individual subtypes. So we know that each patient's progression and symptoms will be different, and we want to match our data to appropriate therapies for each patient. So the study activities, it is an observational study, so there's no imaging or invasive procedures that is required. Most of the study will consist of patient questionnaires. We look at clinical outcomes such as day-to-day functioning, anxiety, depression, and sleep. We'll do a cognitive test, and then we'll also have a fairly extensive medical and family history, as well as some blood work for genetics. Our inclusion criteria is a diagnosis of Parkinson's disease, any form of atypical Parkinsonism, as well as any form of dementia. We're also looking for healthy controls to participate as well. The study visits themselves are just once a year. They're held at the Gardner Neuroscience Center. And then you can see there's a map up there that gives all of our locations for each of our patients. The goal of this study is we want 5,000 patients in total, 2,000 Parkinson's or Parkinson's-like, 2,000 Alzheimer's or other dementias, and 1,000 healthy controls. You can see on the slide that we currently, this slide has been updated a little bit. We are at 897 patients. Of those, 770 are Parkinson's or Parkinson's-like, 48 have Alzheimer's or other forms of dementia, and 75 are healthy controls. The next study I want to talk about is the SPARKS-3 study. It's a phase 3 trial looking at the effects of aerobic exercise on Parkinson's symptoms in non-medicated patients who've had a diagnosis of less than 3 years. The reason that they're looking at aerobic exercise specifically is in preclinical studies using mice, they found that it may offer a protective effect against neurological damage and brain atrophy. So the primary endpoint of this study is we are looking at changes in the UPDRS, which is a Parkinson's disease rating scale, after 12 months. So ideally, the score will go down after that time through this exercise program. So our patients, they're exercising at either 60 or 80% of their predicted heart rate maximum. To give you an idea of what that is, for most of our patients, that would be like a fast walk. They exercise on a treadmill 4 times a week for a half an hour, and they either do that at home or at a local gym. If you do that at home, the company of the study will actually provide you a treadmill to set up. The study activities themselves, Since this is an exercise study, we want to make sure that you're cleared by your physician for exercise. So there would be a physical and neurological assessment done by the neurologist, as well as a DAT scan to confirm your diagnosis, as well as lab work. The actual visits, we go through medical history, any forms of medications. We'll do a 6-minute walk test, and then we'll do what's called a VO2 peak test. That's to determine what your max heart rate will be. And then we'll also do some additional lab work. Every patient in this study will receive a puck and a strap to wear during their exercise. That will collect all of their heart rate data, and that will tell us which range or which zone that they're in, either the 60% of their heart rate maximum or their 80%. From this data, all of that is stored in our database so that the primary neurologist can look at it when he chooses. For this study specifically, we're looking at a Parkinson's diagnosis, again, of less than 3 years, and any patient who is not currently on any Parkinson's disease medications or looking to go on any Parkinson's medications in the next 6 months. For this study specifically, the patient also needs to have a diagnosis of bradykinesia, which would just be slowness of movement, and at least one of the following: muscular rigidity, a rest tremor, or postural instability. For the exclusion criteria, again, not on any Parkinson's medications. We do not want patients for the study who have early severe dementia, any repeated strokes, or cardiovascular, metabolic, or renal disease. We also do not want patients who are currently not on a stable dose of anti-anxiety or antidepressant medications. There's more exclusion criteria as it is, but I just did not have room on my slides. The next study is, it's called the TOPAZ study. This one I like a lot because it's done all at home. This is for patients who are at a high risk for falls. The study is looking at a single infusion of what's called zoledronic acid to reduce the risk of fractures in any patient who is likely to have a fall. The medication itself was additionally approved to treat osteoporosis in 2001, but they are now trying to see whether it has any effects for Parkinson's. Again, this trial is all done at home, and a study nurse would actually come out to the house and deliver a one-time infusion of either the drug or a placebo. After that time, the only other assessments that are required for TOPAZ is every 4 months. That study nurse would give you a call, and they would review if you've had any falls in your home and whether those falls have resulted in any fractures. The inclusion for TOPAZ is a diagnosis of Parkinson's or any atypical Parkinsonisms. They did also add that any patient who is wheelchair-bound or bedridden can also participate, and that you're willing and able to continue in the study for up to 5 years. The exclusion criteria for this is history of a hip fracture, any use of the class of drugs used to treat osteoporosis within the last 6 months, any invasive dental procedures, and any history of multiple myeloma or Paget's disease. So these are my studies. I'm now going to pass the microphone to Kelly, and she's going to talk about hers.
Where's the clicker? Okay, thanks. Hi, everyone. I'm Kelly. One of the studies that I work on is called Racial Disparities in Parkinson's Disease. So this kind of looks at what does it look like for someone who's white to have Parkinson's disease versus someone who's black. 40% of Cincinnati is black, but only 5% of the patients in our clinic are black. So we're trying to understand that trend, and this is a common trend across many different cities. So there's different sites at different cities like Chicago and Baltimore where black populations are prominent, but not prominent in the Parkinson's disease population. So the first aim of the study is to determine the unique Parkinson's symptoms that they can have and like how Parkinson's can present in Black people. And then the second aim is to evaluate how their care is managed by doctors for Black people versus white people. So we ask a lot of questionnaires about how long have they been seeing a doctor, what kind of doctor do they see? Are they a movement disorder specialist? Is it their primary care physician? Is it a general neurologist? Things like that to better understand what their care looks like. And then our third aim is to look at the genetic side of things. So this study is a part of 2 different genetic databases. So we have the GP2 and then we have the PD generation. So these are huge databases with a lot of different biomarkers that are donated by a lot of different participants, but unfortunately the Black population is not very well represented in those, so they paired this study with those 2 studies to be able to contribute to those databases, which is really important. There we go, okay. So we're currently recruiting Black and white participants. During the visit, there's cognitive, neurological, and motor assessments. So the cognitive and motor assessments are done by a research coordinator, so me or Lauren, and then a bunch of questionnaires that we go through on an iPad together, and then the blood draw. So it's just 4 tubes of blood, and then you also get to see Dr. Hill, who goes through a normal assessment that you guys all know how to do. And it can take 4 to 6 hours, depending on how much we're chatting and how long other things can take. But we usually schedule for 1 day, and then if we want, a lot of people choose to schedule a second day if they can't finish everything. But it's just a one-time commitment, and it's all observational. So, yeah.
Hi, everyone. My name is Lauren, and I am the primary coordinator for the Jazz Patagonia study. What we are looking at is the use of a drug called suvecaltamide to reduce tremor in PD patients. Tremor is one of the most prominent features of PD, as most of you in this room know. A T-type calcium channel plays a critical role in regulating rhythms in the brain that control movement, and suvecaltamide is a modulator of that. It is hypothesized to reduce channel activity and restore normalized brain oscillations, and it selectively works on overactive channels, preferentially targets and stabilizes abnormal brain oscillations. So the overview of the study, basically you'll be in the study for 23 weeks if you do make it in. You'll be randomized 1-to-1, whether you're on placebo or the drug. We're gonna have about 160 patients in the study worldwide, and you will be in it for, you'll be actually on the drug for about 17 weeks. These are the inclusion-exclusion criteria, but basically what we're looking at is if you are between the ages of 40 and 85 and you have PD and you're taking levodopa but your tremor is not going away, then at some point today, come find me. And here's the next study.
Hi everyone, my name is Aisha Sheikh. I am the study coordinator for PPMI, and I specifically work with Parkinson's patients. So PPMI is an observational study made to understand the onset and progression of Parkinson's, and their overall goal is to identify biomarkers of disease progression in order to create new treatments to help treat and also reduce the progression of Parkinson's. The study has 4 groups that you'll be placed in. First group we're going to be talking about are the healthy control. These individuals do not have any neurological disorder or no Parkinson's. Second group would be prodromal group. These individuals do not have Parkinson's, but they have a high risk of getting Parkinson's. They either suffer from the loss of smell or they have RBD, REM behavior disorder. Third group would be Parkinson's. These individuals do have Parkinson's or they have Parkinson's with a genetic variant. Last but not least, the legacy group are individuals transferring from the original PPMI study into the 2.0, which is the study we're talking about today. Do you want to? Okay, so this is just a general overview of how your participation will look like in PPMI. We'll bring you in for the screening visit. Once we get confirmation that you indeed qualify for the study, you'll be placed in one of the 4 groups that I mentioned before. We'll have that baseline visit. That baseline visit is a bit long. Again, that could be broken up into more than 1 day based on your comfortable, whatever you prefer. And then it will be a mix of in-person annual visits and remote visits after that. Some of the procedures that we'll be doing in these visits would be a DAT imaging. Some assessments would be motor, cognitive, some neurological assessments that Dr. Espay or Dr. Hill will do with you, some questionnaires, and some samples such as blood work, urine sample, CSF sample will be collected through a lumbar puncture, and a skin biopsy will be done. This is just the inclusion and exclusion criteria for the Parkinson's group. We're looking for male and female individuals who are 30 years or older. They're diagnosed with Parkinson's, and they must have the SNCA or a rare genetic variant. You'll be asked to undergo a genetic testing to make sure that you do have that. And you must have at least 2 of the following: resting tremor, bradykinesia, asymmetric resting tremor, and asymmetric bradykinesia. SPECT imaging or DAT imaging will be done to make sure your PD diagnosis is correct, and you must be able to give informed consent. Some things that might prevent you from participating in the Parkinson's group would be receiving dopamine receptor blockers, metoclopramide or reserpine within 6 months of your screening visit, any treatments with blood thinners, any spinal conditions or bleeding disorders that prevent you from having a lumbar puncture, any medical or psychiatric conditions that prevent you from participating.
Hi, my name is Bobby. I am the primary coordinator for the prodromal cohort and the healthy control cohort. So the eligibility criteria for the prodromal cohort, so we would confirm that you're eligible based off of the UPSIT smell test. We would have you do the DOT scan to confirm eligibility. You cannot have a first-degree biological relative that has PD. And you can be male or female that's 60 years of age or older. We can get a medical waiver if you're close to that. Just let us know and we can work that out. Exclusion criteria would be clinical diagnosis of PD at screening or another Parkinsonism or dementia, receiving any of the following drugs: dopamine receptor blockers, metoclopramide or reserpine within 6 months of baseline, current treatments with anticoagulants, and taking levodopa, dopamine agonists, MAO-B inhibitors, amantadine, or another PD medication. So for the healthy control group, you can be male or female, 30 years or older. Individuals taking alpha-methyl-dopa, methylphenidate, amphetamine derivatives, or metaphenyl must be willing to medically hold these for at least 5 half-lives before SPECT imaging, so that's the DAT scan. Confirmation that you're eligible based off the SPECT imaging, and then that you're able to provide informed consent. So healthy controls, really, those are patients that would be like a spouse, a significant other, or a friend, somebody like that, that would be a healthy control. Exclusion criteria would be a first-degree relative with PD, current or active clinically significant neurological disorder, previously obtained MRI scan that has evidence of a clinically significant neurological disorder, receiving any of the following drugs: dopamine receptor blockers, metoclopramide or reserpine within 6 months of screening, current treatment with anticoagulants, or a condition that precludes the safe performance of a lumbar puncture. So the current status of the study, so for our site, we have 21 PD patients. 7 of those are transitions patients from the original study. We have 17 prodromals, 17 plus, because we have some scheduled for May. And that goal is to have 35 at our site. So we're still looking for additional participants. Healthy controls, we have 2 out of the 5 that we're looking for at our site. And then for the whole study, we have about 45 sites and about 2,896 transition and new participants. I think the only thing I didn't say about the prodromal cohort is that it's looking for patients that have REM behavior disorder, so thrashing around in your sleep, jumping out of bed, things like that, or people that have a loss of sense of smell.
Hi, my name is Kevin Duque, and I'm going to present the next 2 studies. The first one is called Dementia with Lewy Bodies and PD Dementia Study. Some factors related to cognitive difficulties are these here: limited physical activity or social activities, sleep conditions such as sleep apnea, low blood pressure, depression or anxiety, and some medications. On this study, we'll focus on low blood pressure. Some patients with Parkinson's disease have low blood pressure, and sometimes that happens when they stand up. People without Parkinson's disease with normal autonomic nervous system will have ways to prevent or to keep the blood pressure normal. But people with Parkinson's disease have an impaired autonomic nervous system. The autonomic nervous system is the system that keeps the autonomic functions of the body and keeps the blood pressure normal. So what we see in Parkinson's disease is something like this: many ups and downs in the blood pressure. The blood pressure can go up to 200 or 160, and it can go down in a few hours below to 90s. It could reach 80s or so. So this is what it happens to some patients with Parkinson's disease, and mainly those with dementia. So what we have done a study here at UC, at University of Cincinnati, and we saw that even though we had some patients with low blood pressure when standing, 38% of them did not have any symptoms. So another way to find if this low blood pressure would give some features of cognitive impairment is doing a electroencephalography, which is a brainwave test. So this way we can see the shapes and the waves, so we can see more or less if there is any features of cognitive impairment there. So in this study, we aim to determine whether low blood pressure causes cognitive fluctuations in these patients with Parkinson's disease, dementia, and Lewy bodies, and dementia with Lewy bodies. We include patients who have any of those diagnoses and who are taking medications to enhance memory, such as Exelon, Ariciped, or Namida. The study involves doing an electroencephalography, laying down and up on a tilt table test, 30 minutes each position, and we give patients a blood pressure monitor and a cognitive diary for 24 hours. So we can see if there is a match between the cognitive fluctuations patients report during the day, such as sleepiness, dizziness, or memory problems that are sporadic, and we see if at that time there is a low blood pressure. The importance of this study is that if confirmed, so we can test if we can improve cognition of people with Parkinson's disease and low blood pressure by increasing it. The second study is the synuclein multiplication study. As Dr. Alberto Espe said, synuclein is the major protein that is talked about in Parkinson's disease. When we do, and he showed, when we do a biopsy, or well, actually an autopsy of the brain, we see lumps of Lewy bodies, and inside of them there is this protein which is aggregated as this protein, which is the synuclein. So there are some patients, it is a very rare mutation. Less than 1% of patients have mutations in this gene that causes a duplication of the amount of synuclein that is expressed. So some patients will express 2 or 3 times more the amount that people without Parkinson's disease expresses. And this has been, as Dr. Espe said or explained before, this has been the main topic over the past 20 years of research, of previous research studies. Since they saw synuclein inside the Lewy bodies in autopsy brains, and they saw that there is, or that gene, or there are people with Parkinson's disease who have mutations on this gene that produce more synuclein. So they thought, okay, so we had a brain with normal amount of synuclein, so this synuclein may be toxic. That is what I thought, always. So they thought, okay, this synuclein is toxic, and they clumps together on the brain, and that may be the reason why these people have Parkinson's disease. However, recently, 2 big studies that eliminates or that clears the aggregated synuclein up from the brain of patients with Parkinson's disease did not show any difference on the outcomes. So patients who received or who clear the synuclein from the brain, the aggregated synuclein from the brain, progress in the same way as people who received placebo. So what we saw actually is that instead of being a high amount of synuclein in the spinal fluid, actually patients have a low levels of synuclein in the spinal fluid. And this is what Dr. Espe has been talking about. So what we think is, it is not the aggregated protein which is inside the brain, but it is the amount of normal soluble synuclein, which probably is what it drives Parkinson's symptoms. So the aim of this study is to determine if Parkinson's disease is caused by the toxicity of aggregated proteins or the loss of functional proteins. We include patients only with Parkinson's disease due to this rare genetic mutation, which is called a synuclein multiplication mutation, confirmed by a genetic test, and we also enroll the relatives. We do 1 spinal tap, 1 nasal swab, 2 3-milliliter skin biopsies on the forearm and 2 on the back of the neck, and 1 neuropsych testing. We do skin biopsies and nasal swab because, as we can see, those aggregated proteins in the brain, it's under development that we can see more or less these samples, these bodies in the skin and through a nasal swab. The importance of these studies is these, I mean, if true, if confirmed, this will support development on protein replacement or rescue therapy that Dr. Alberto Espe was saying. I know the last slide includes the names of everyone, if you have any questions.
Thank you, everybody. We appreciate this.